Specialist, and today I'm going to talk about a subject that I get a lot of questions about, which is with fillers. So we're going to talk about whether you should be really scared of fillers or not. I know that's something I get a ton of questions about, and there's a lot of people who are always concerned about it. So happy Halloween. We're going to talk about these myths and also the fear of filler, and whether there's some things that we should be scared with it sometimes. And, I'm kind of aware of it also that, well, not kind of, I'm very, very aware of the way filler can migrate. I'm very aware of the consequences of too much filler. I do so much dissolving in my practice. I dissolve a lot of filler in my practice. I'm not sure if anybody dissolves as much as I do. The ultrasound has been really, really critical for me to use for dissolving purposes. And it's been amazing to be able to basically restore patients' skin that was stretched out due to filler. So I'm going to talk a little bit about that today. It's going to be our spooky Halloween topic tonight for Halloween. We're going to be talking about filler because I'm sure some of you guys have seen kind of scary, at least maybe not in person, but you definitely have seen photos of it, scary examples of filler. And it's something that I think, needs to be talked about a little bit more. I know that some people are, like on my side of things, are a little bit scared of almost bringing it up. They kind of feel like, it's going to hurt their business if they talk about the consequences of filler, things like that. But it's important. I think that there's no question that there was way too much being done in people's faces. It was really, really too puffy, and just the layers that they're putting it in was really, really problematic for a lot of patients, and there was a lot of consequences for it. It was just stretching people's skin. It didn't look great, long term. So it's good to just kind of be aware of that type of thing, and be aware that there's, that there were problems, and the things with the problems, it didn't last just a year for a lot of patients. It was lasting for years and years and years. I've had patients who, like 8 years, 10 years, 12 years later, they still had filler. And it's really something that I want to talk a little bit about because, we should be aware of like where you're getting injected and things like that. Happy Halloween to you too, Anita. Thank you so much. I don't know if you guys went trick-or-treating or anything like that and where you guys are located. I just came back. It's almost, honestly, every year it feels like it's almost a little bit drier. Like every time I go out there, it feels like it's a little bit drier, I think. With Halloween, we have to go to multiple different neighborhoods for it, but it seems like not as many people do it as much. Audrey's saying, do you ever do off-label Sculptra for under eyes? I think it's a terrible location for the that product. I really would be really concerned about nodule formation with Sculptra underneath the eyes. Even like really dilute forms of it, there's something called PLLA in there, and that PLLA can just continuously stay in the system. And, I'm not even sure if we necessarily know how much of it gets degraded and gets absorbed by your body. And I'd be really worried about something like that in the eye area because it's a circular muscle. And as you're kind of just smiling and talking, you could be potentially pushing out that product and making it too superficial. And then you could really run into a lot of problems with that. Let's see. Ryan is asking, are implants better than fillers? Well, it depends on the location that you're placing it in. If you're kind of looking at, someone's bone structure, how much volume deficit there is. Sometimes you have to actually see whether or not they actually should be seeing someone like oral maxillofacial surgery to really do jaw surgery to actually pull the jaw forward because perhaps they are mouth breathers or they just have some deficiency there that essentially requires a full surgery to really pull and restructure that jawline. Rather than just doing an implant, you really have to look at that underlying problem there. And sometimes, I refer patients to someone like an oral maxillofacial surgeon to be able to take care of it, to go at least look at the problem and look at that deficit that's there. It is a bigger procedure, there's no question. Jaw surgery is a really, really big deal, but maybe that's what you end up needing. I'm not sure. And something that people should pay attention to also is that you really do get more chin recession if you're a mouth breather. So, consider doing something like I use silicone tape as like my mouth tape. You guys know I talk a lot about silicone tape on here. I love the one that we use. And it's really great just over the mouth, and just it helps basically just making sure that you can breathe through your nose. So that's personally what I personally recommend doing. I'm going to actually still stay like Prince Charming tonight. I'll keep this up here for us, so we could keep the look going here. That's what I was walking around like today. Let's see here. What was the question here? So I have tretinoin 0.5% with isopropyl myocyte. Is that okay for acne? Yeah, that's perfectly fine. It just may be a little bit overly drying though. So just see how drying it is. You may still want to use a little bit more of a moisturizer initially. So for the first 2 to 4 weeks, probably mix it with a little bit of a lotion. Who is a good, I think you're probably asking about a jaw surgeon. Actually, I don't actually know somebody particularly. I just tell patients just to find them themselves because I actually don't have somebody that I just particularly refer to. At some point, I'll take a look and see if there's anybody that I could trust with it. It's usually something that really does need a high level of skill, and I haven't really found anybody particular that I would just say that like is the person for patients. Not yet, at least. It's just I think a really specialized skill set, and patients sort of just have to kind of take a look at that themselves. It's just what I would recommend, like go to somebody, and I don't necessarily have somebody that I would say this is the person to go to. Hard is saying, getting to lip filler in a few weeks, is it true it always migrates? Good question. Actually, a really, really good question. Does lip filler always migrate? I think there's a possibility that it could actually almost always shift a little bit depending on how it's placed. It's possible that if it's in the vermilion border, that really over time it could shift and migrate just a little bit. Now, whether there's enough of a consequence of it, if it's really like that significant of a problem, remains to be seen for some patients, depending on the product that was used. But when it's in that border where people really like it, actually, it's possible that some of that little bit of that could migrate. I do find certain fillers don't migrate as much as other ones. I really do find that Juvederm, some people just call it Juvederm, Movederm. I really do find that most of my practice, when I'm dissolving filler, it tends to be Juvederm line product. And I tend to find more problems with it. I do find that we've had to dissolve a lot of nodules even in the past, which are basically something called Vicross. It's essentially the technology that a lot of the products use, like Volbella, Voluma, Volux. They use something called Vicross technology. And sometimes patients get a reaction to that, and it causes a nodule. And that nodule could be a real challenge to dissolve completely. It could be really, really problematic for people to dissolve. And so, I don't necessarily recommend that, really. I think especially in the lip area, you want things that aren't going to move really much. So really, Restylane Kiss is a really good product in there. I think it's really, really nice. Even a little bit of Versa sometimes. Sometimes you could use also different lines of products, for each individual patient. Like I don't necessarily just use only like the Galderma line of products. Sometimes I will use something like Versa, for example, for like little bits of the lip too. Like sometimes you could use that like on the little corners, you could use a little bit of a different line. Or if you use like something like Restylane Kiss, you could use that in the central portion, and then you could use something like Refine or a little bit on the sides there. Should it be safe around smiling lines? I do not use Juvederm around smiling lines. Like I said, it's a product that I find moves a lot, and so I usually don't use it. I think actually around the smile lines, the best product ever is Bellafill. I really do. Little bits of it just around there works very, very well there, and it looks very natural. It stays there. So that tends to be more of my go-to product really for the smile lines if people are open to doing more of like a long-term collagen-based product. What do you recommend for crow's feet? Really, Botox or Dysport or Xeomin, that's probably going to be the best option there initially. But if it really is like collagen destruction over there, then something like a collagen-based product, again, Bellafill could work really well there. Let's see here. Andrea saying, is jaw surgery usually covered by insurance for breathing purposes? Yes, it's difficult to prove it though for insurance purposes, and you may have run into some issues with getting it approved. But yes, it could get approved by that. That's not my forte. It's not my particular field, but it's possible there. User 82 is saying, what about hip dip filler? Do you recommend it? Will it infect me? Well, we're going to keep it clean over there, but usually what I use for hip dips is going to be Sculptra. It's really a great product over there. overseas, they have some other hyaluronic acid filler. It's a lot cheaper, but it's also not going to last as long. Sculptra is really, really nice. I've had patients for years and years who just love the fact that their butt basically feels more firm now, which is really nice. So, this outfit, I gotta get a new Prince Charming outfit, I think, for next year. Let's see here. What did I miss here? Where was I? Instead of, so let's see, Nicole is saying, instead of 11s, I just have one wrinkle between my eyebrows. What do you recommend for the glabella? Well, it's still part of the, that's basically still the 11 is just one of them. But really just still stick with doing like Dysport or Botox. Let's see, a woman of the world is saying, I only use biostimulators now. Yeah, that's what I pretty much only use to for my own face. And someone was asking, how do I look so young? I mean, I am 42 years old, so I really appreciate that. And it's really nice because I think I was able to hold off on the volume loss that I was experiencing sometimes, and just like I was feeling like my skin quality wasn't the same. And now it's like it's much better. It's like it's really kind of where I was almost feel like my skin almost feels like it was when I was in my 20s. Like during my 30s and things like that, I was setting up the practice and was really, really busy doing all that kind of stuff. So it was like, I feel like my skin quality got really, really gaunt. It got really like just kind of like really rapidly lost a lot of weight there. And the really collagen fillers like saved the day for me. So that's why I believe in it. I love it. It's just like, it's been amazing there. Someone's saying, wait, you're 42. What did you use? So yeah, mostly what I do, it's pretty straightforward. I talk a lot about this, is that I don't really do like too much with skincare things. I don't really believe in doing too much with that. I try to keep it really simple with skincare things. But mostly what I do is collagen-based products like Bellafill was amazing for my face, like amazing for my skin. I also used a bit of dilute Radiesse at 1.2. And that really, like, I think I would say those are like the biggest things that actually made the biggest difference. Then plus lasers. I do like lasers every 6 months or so, which helps a ton. Asian Spy is saying, how fast can I be seen after making an appointment for consultation treatment getting done? Sometimes if it's like a filler appointment, we could probably do it the same day. If it's more like scars, things like that, we're probably going to have to schedule that another day. But we could do that, right? With for patients for fillers. So a lot of times with fillers, we'll just do it right then and there. You may have to wait just a little bit, but I'll get to you then and do it really, really well for you. So I love doing fillers. I do a lot of facial balancing in my practice actually, and it's one of my favorite things I actually do. It's like I like it really more from the forehead all the way down, and just really just making it so that it's all fully balanced there. Marley is saying, what filler do you suggest for crepey neck and laxity? Right, actually, probably the best filler for that area is going to be Hyperdilute Radiesse. So it's a calcium-based product, but what's really nice with it is that it stimulates elastin production as well as collagen production. So you're going to get some firmness in your skin. You're going to get a little bit of volume as well. And then that collagen production was really, really nice. So you get to keep all that. So you don't see as many lines in your neck. Really, years later, actually, again, like years and years later, I see patients and it still looks excellent. I didn't have to do as much as, sometimes even the reps will tell you that you have to do a lot more than that. And it ends up just lasting so well for patients. I love it. It depends on how much laxity there is. Of course, like you may have to do like a facelift, neck lift. But if it's mild, if it's just a little bit there, it could be an awesome idea. It could be really good. It's actually, I think, really underutilized for a lot of people. I've been using, when I was first starting my own independent practice, I actually didn't go with hyaluronic acid fillers. I actually didn't. I initially did more with collagen stimulating products, especially I was really, really big in diluting Radiesse, and I loved Radiesse because it was something that I could see like immediately, but over time it would continue to get better and better for patients. It was really fun to see that though, and it's like that progression over time was like really nice because you could see that not only were we giving some volume, but the skin quality itself was really good. Hi Michael, how's it going? Happy Halloween, Luciana. Thank you so much. What were you guys doing for Halloween, by the way? If anybody want to put down what they were wearing for Halloween. Miles saying, what's the best product for under eye hollowing? Well, there's probably not going to be a product for that. You're probably going to need filler. The best spot to do filler initially is going to be to make sure that your mid-cheek fat pad is supported. So that's a really important place to make sure you have some structure over there. And I don't mean with a cannula. I think that's really terrible, actually, to do a cannula in the mid-cheek. It could get really too superficial there. If you're doing the right product, it's maybe okay, but a lot of people don't use the right product. I dissolved a patient the other day who they unfortunately went to somebody and they used a cannula and they used Voluma and they put it too superficially and just these big balls in the middle of his cheek. Terrible. It's really, really terrible. It's a really unfortunate that I talked about that yesterday too, but it's it's not necessarily migration then. It's really just poor technique. It's really that you're using an inappropriate product for that area, and you're doing it in a location that it's not designed to be. Like Voluma is a very thick product. It really should be going down to the bone, and so I'm not sure why somebody is using a cannula and doing it in the mid cheek like that. And really, if you look at, like my own kids, things like that, like everybody has a little bit of where it's flat in the mid cheek. It's normal. So when it's really puffy in the mid cheek, it's very, very odd. And there was like this epidemic for the last few years of people just shoving so much filler in the mid cheek. It looked really odd for so many people. So, you look at that, you walk around and you'll see that problem. And that's what happened. Like I came from Chicago and everything's really like more natural and like softer over there. And I came over here and I was like shocked. And I was like, I don't think that I'm going to be able to to do filler over here because the aesthetic is so different over here. And it turned out actually that there's a lot more people that wanted that natural, softer look over here. It just was not really like pushed as much. And just, you sort of recognize the bad work out here. But there's a lot of people that really were craving just like more of that natural, untouched look. They just wanted something, but they were so scared because they also saw, like everybody's aware of it. You're aware when you're looking at things that this does not look like a normal human anatomy right here. And you see like, certain celebrities, it's like, I see it too. And it's like, it's sad. I look at that and it's really, really sad. You have people like that. And it's like, why would you do that to someone's beautiful face like that? Is peeling good for melasma? It could be. I usually do more. You could do topical creams. You could do pico laser. Those are all good options. You could also do something like oral tranexamic acid. All good options for melasma. I do so much with melasma, so I'll be happy to help you with that. C saying, best method for heavy nasolabial fold. Good question, C. If it's really truly heavy, if it's really like the weight is pulling down, there's probably not going to be too much you could do other than really more of a facelift, to be totally honest with you. There's probably not going to be too much you could do with that. If it's more of a mild case, though, then you could do something like a filler. Like I said, I do like Bellafill as one of the better products there. I think it's really good for that. But you could also do a little bit of hyaluronic acid filler. The problem with HA filler there is I do find that it migrates. If you look at a lot of the patients that I end up dissolving filler with, again, they are using Juvederm a lot of times, but what happens is that they're placing it in the nasolabial fold, and as patients are smiling and animating and talking, that filler is constantly shifting because of the location that they place it in. They place it a little bit too superficial for them. And in that area, in the nasolabial fold, you can't really go too deep. You could do it in the piriform space like over here, but really not too much elsewhere. So it's like kind of tough really to really soften that nasolabial fold. And you sort of just have to tell patients just accept that you're going to have some nasolabial fold. I've accepted. I have some nasolabial fold. It's like I just don't want to make it like puffy and like make it like too soft there. Smiley saying, where'd you put Bellafill in your face? Pretty much everywhere. My entire top, like I don't know, forehead, temple, cheek, chin, jawline, nasolabial fold, little bits, like in multiple different spots, and it worked out really, really well. I do it like it's a product I'm super comfortable with. I know I'm fully aware of like people saying that they're not comfortable doing it, and like I always say that if you're not comfortable doing it, you shouldn't do it. That's the truth. It's like the truth of the matter is that if you're not comfortable doing these products, you should not touch them. You shouldn't do it. And if your aesthetic is such that you think that this puffy overdone look is like something that's more that is natural for you, and sometimes I've seen it. Like sometimes I see the same like TikToks you guys do. I see the same Instagram stuff, and the person's on there talking about how they are like natural and they haven't done much work or something like that. And it's like, it's so obvious that they've done so many things. So I also think that people should be like open about the stuff, at least from our industry. Like we should just be a little bit open about that thing and just let people know kind of what makes sense for them too. That this is potentially what you could look like, and this is potentially what these products could do for your face. It's like, and this is their aesthetic also. What about Sculptra? Sculptra is good for like more severe volume loss, I think. I didn't really push it myself for my own face because there's a certain way to do it, and to be honest with you, it's like you have to be extremely careful with it. I'm very, very careful with when I do it, and it's like certain areas you could do it in the temple area, but sometimes in the cheek it could shift someone's natural anatomy a little bit there. Bellafill could as well, but like it's a lot softer product. It's a little bit more forgiving sometimes. Sculptra can be a little bit more diffuse. It can kind of spread a little bit more and spread in pockets that you may not expect and things like that. And I think the way to really do Sculptra a lot of times is to go deeper than the way they actually teach it. That's the way I actually prefer to do it. I think it's actually better to do it a little bit deeper. You still get a great effect, and it doesn't move, it doesn't shift really that way. So that tends to be how I do it. Can you please put some Sculptra before and afters? Can I see facial sculpting with Sculptra? Usually I do a few different products, so I'll put something up right now, but I'm not sure if I have one that's just only Sculptra. So I usually do a few things. So let me see if I can find one that's just Sculptra on my computer here. Let's see here. Does moderate acne scars can be less expensive? It depends. I mean, like, I don't have to do everything for everybody. A lot of patients I don't even do subcision with, or I don't do TCA cross necessarily, or whatever else is there. It just depends on really what's happening with your skin and what kind of scars we're looking at, what we're dealing with. I just tell you exactly what's needed to get to your best possible result. That's what I try to do. Adrian's saying, I get Restylane Silk even though it's an HA filler. I only get one syringe split between my cheeks. Do you like it? Honestly, I never loved it. I never did. I like a lot of the other products by them. The reps know. I just don't like Restylane Silk. I found that was just like a product that just was too hydrophilic. It drew in too much water, and I just didn't love that, honestly. You know what? I guess I don't have it on my... I have Dilute Radius, actually. This is Dilute Radius, though. You can see this patient. Let's see if I could show that for you, though. This is Dilute Radius here. So really, really nice improvement for this patient. Really, really wonderful. It's something very, very natural. Looks untouched. Exactly what she was trying to achieve. She really did not want anything that was a puffy look. Was really avoiding fillers for so long in her life because of that. So really nice that we were able to achieve that for her. I think she's somebody who has a particular facial structures that if you put too much in there, it would have been very, very obvious, very, very fast. So Dilute Radius really was a game changer for her. I also did a little bit of hyaluronic acid filler, just a tiny little bit underneath the eyes too, just to help soften up the tear trough area. And you can see, it's not like completely smooth underneath the eyes. That's on purpose because you could see she has some bags underneath her eyes, and I was worried that because you put a hyaluronic acid filler in there, it could end up drawing in too much water, and so I didn't want to do that, of course. So sometimes you just sort of have to accept that it's not going to be 100% perfect like that. And the truth is that sometimes these people that show like these perfect under eye results, you have to see how it's going to look 6 months later, a year later, because I deal with so much of that. I deal with dissolving so much of that, and a lot of times it's not the best. Really, it's like initially it looked great, and then 6 months later they go to someone like me to dissolve it. So it's because you can't get like complete smoothness. And when there's like this puffiness underneath there, you're doing a product that draws in water, and now you could end up really running into problems, especially for a patient like that could be potentially older like this, where it shifts and migrates and it causes lymphatic blockage now, and that's not going to look great long term. So that's, I love doing it. I love doing, full facial balancing like this particular patient right here. She was really concerned, especially when the biggest things she was concerned about was really her nasolabial fold, and it's successfully, softer there. So that's really achievable. It's this is like, close to what we would probably do, the maximum amount that we would do for that. I really wouldn't want to do much more than that. That's a very, very realistic, beautiful result. She gets to keep that result, and her skin quality got better and better. That's what's awesome. Like, there's just no question that over time, her skin got better and better over time. So appreciate you guys for saying that. They really, really do. It's like, I love doing this kind of stuff. I just the thing is that every day when I sort of talk about doing filler and I talk about it for scars and things like that, And people are so worried about it. People are so worried about like or they'll just flat out say, I just don't want to do filler. I never want to touch filler. And there's different kinds of filler. So it's not just like, hyaluronic acid filler out there. There's collagen stimulating products. There's all sorts of stuff out there. So it's like, and there's also different people that inject. There's a lot of people that inject very, very well. There's a lot of people that do. And there's a lot of people that probably shouldn't be injecting. It's like, I'm not sure what they're thinking, what some of the aesthetic choices that they're doing sometimes. To be honest, I'm not sure. Like, it's like, what was that? Why did you overfill like that celebrity like that? Why did you do that? And it does a huge disservice to the celebrity. And then now it's like everybody's like talking about it, and nobody wants to do filler suddenly because it's like they're so worried about that. And it's not actually just about cheap, honestly. Just look at your injector. That's what I say. Look at the staff. Look at everybody. Look at all people around them, and like see if the staff has gotten injected by them and stuff. Double check, because it's possible that that's the aesthetic. And a lot of people don't need filler, and like they're shoving a bunch of filler in people's faces, and they're putting it in the wrong places and stuff like that. So just double check that. Like, it's not like everybody needs filler. Like, it's really not true that everybody needs filler. So just be careful. Alice saying your chin has green veins on it that it used to not be there. Is it due to filler? No, actually, it's actually hair. So it's actually little stubs of hair. I've been doing laser hair removal, and I talked about that the other day because it is patchy. I know, like, all my patients that like have been seeing me lately have been talking about that. So it's there. That's the process. I kind of want to showcase that for people because I like it everywhere else. So I do like the way like it's like making my skin look a lot smoother otherwise. Actually, like, I really love that. But like there's like this period of time when it's a little bit patchy, and it's like that's what it is, really. It's like, so if you're considering doing laser hair removal and like you're a guy, especially someone like me who has really thick hair, so it's like this is what it's going to go through. Like, there's no way of shaving that. And then while you're doing laser hair removal, you can't like wax or do anything else like that, just so you know. So just that's what's going on. It's not a vein, actually. It's just hair. But I actually, yesterday too, one of my patients I've been working on for like 6 years, she's just like, what happened with the razor blade or something like that? And I was like, no, that's just going on. But yeah, that's what it is. So you can kind of see that whole process there. And with me, I'm like open. Like, if you want me to like go through the process of everything I've done, I'll be happy to show you that, because it's like, I like the fact that this stuff is there and it's accessible to me, and I could show you guys kind of that whole process. And I come on every night, so I can't hide from you. So you'll see you'll see like everything that I do, and like if I do a laser or anything like that, you'll know. But no, it's not from filler. It's literally just stubs of hair that just can't come off yet. Once I do another laser round, like in a couple of weeks, I think I'll be able to do it, and then it should hopefully calm down a little bit more then. What filler do you suggest for temples? Temples, the best, honestly, is Bellafill. I really think it's the best product out there for the temples. You just have to be really careful when you're doing it, but it's a really, really beautiful product for the temple area. That's usually my go-to for that. Temples is that. Let's see here. Someone is saying, or Alice is saying, Dr. Qazi, your cheeks look great. Can we reach the same results with Sculptra? Good question. And it's questionable, honestly. I think it's questionable. Let me just put it this way. I think that I like Sculptra, but I'm a lot more conservative than the way they do it by the book, the way that they teach it. I don't do nearly as much product of it because I do find that sometimes it could look a little bit more artificial than I would like, honestly. I think just small little bits of it, that's what I usually do with it. But in the face, sometimes I just don't feel like it stretches the way I will love it to when people are animating. And that tends to be why I use more Bellafill. I just find it just more natural, especially in the cheek area. It just looks like your real skin. It feels like your real skin. There's no real problem with it after. Like if you're doing facelifts or neck lifts, things like that. My partner does it afterwards with patients that have done it, and she has no problem with it. She said it just looks and feels just like real skin. So I like that. Queen's Collection is saying, what about under eye lift to tighten under the eye? You could do laser there. Like, one of the better lasers for that area is probably an erbium laser. Usually, sorry. Let me just get some. I had a piece of chocolate before I came. That's how. Don't eat chocolate before you come on. But yeah, erbium laser is good because it's just it's not too sorry, excuse me. There's not too much heat there. I'll just drink a little bit more in there. I know it's actually really good with no sugar, and then I just had a little bit today, and I was like, that's my lesson now to cut back on sugar again. So erbium laser is actually, it's good because there's not too much heat with it. So it's good, especially for darker skin types. You don't actually generate as much post-inflammatory. Stay alive. Thank you. Are there any discounts for Bellafill and Sculptra for your patients? Yes, we have it with our members. Actually, we just take a look at our memberships. By the way, our memberships are awesome. You get unlimited Botox for the whole year. Just so you know, that's one of the memberships. Actually, you get unlimited Dysport, Botox, Xeomin for the whole year, and there's tons of discounts. You get like one free vial, also a filler. So just do that. Honestly, you'll get. There's a lot of different deals that like we secretly give the members to, things like that too. So take a look at the memberships actually with us. It's like I know I do a lot with like scars and like that, but I do a lot with that. Kim is saying, I'm 36. What do you recommend for jowls due to Botox and masseters due to TMJ? Well, probably just wait a little bit for your muscle to go back. But if you need to do the Botox for TMJ, then you probably want to do a little bit of filler right along the jawline. If it's just pretty mild. If it's relatively more serious, like you feel like there's like a little bit more laxity, you're pulling on your skin, and you could feel basically one test to do. Here's a good test: pull on your skin and to see how it snaps back. Like pull it, see how it snaps back there. And if it's kind of like just still tented up there, there's a little bit excess skin. You probably need to do something more like a facelift. You have to probably also see this to see essentially where the jowling is. If there's a lot more volume, if there's like some fat pad that potentially you could potentially take out, like a buccal fat. You could see just how much structurally you need to put back into its right position. Mermaid is saying, are Rejuvenation fillers dangerous for acne scars? I got it done in Dubai and they use it to raise the scar. No, it's not dangerous, but it's Rejuvenation is okay. Like we have Versa. There's the RHA line, which is it's funny. RHA, I think I think continues to grow afterwards. Like I think it looks okay sometimes initially, and I don't really use it because it'll like keep on drawing in water and like keep on going. And it's like sometimes it's like keep on going. So it's like that's why I don't use RHA. Adanelli saying, I got my lips done with Dr. Qazi in Newport. I love them. Thank you so much, Adanelli. Hopefully let us share your results one day at some point. I would appreciate that. I want to showcase some new filler results. I've been doing a lot of them recently, and people sometimes don't let me share it. So if you let me share your results, I would really appreciate it. Love your costume, Dr. Q. Thank you so much, Calray. I appreciate it. Thank you. Can laser for scar damage hair? Well, the ones we're using are going to be typically an erbium laser or CO2 laser, so that's not going to be much of a problem at all for people. I'm going to wrap up for this week, but let me see. Let's actually answer this one. This is a good question. Someone's asking, a facelift or more filler at 32? Really, really good question. So if there really is true laxity, like I said, if you're testing yourself and you're seeing that it's not snapping back the way it should be, you really do need to do probably more of a surgical route to fix that. There's really not going to be too much that's going to fix that. Energy devices aren't going to really give you enough tightening. Nothing is really going to be able to solve that enough, quite like surgery, really. And it's not really based on age. Like I have a lot of patients who are younger age who were on GLP-1 inhibitors, something like Ozempic, for example, and they started to lose a lot of weight and they lost it pretty rapidly. And now they have some loose skin. So you potentially need to do something more surgical for those patients. Just doing fillers, doing radiofrequency microneedling, the way everybody tries to push radiofrequency microneedling for that stuff, it's not really appropriate, especially for gaunt patients. If you're gaunt, meaning like you just normally naturally just don't have much fat, especially in certain areas, you probably shouldn't be doing too much radiofrequency microneedling. I know somebody was asking about that earlier. Like in some areas you could do some of that, or if you go really light. But I have so many people that tell me that they use it and they think that they're supposed to go on maximum settings for this stuff. I've had conversations with people. They've messaged me. I've gone to conferences and people are insisting that you're supposed to use these high settings for this stuff. And so it's really, really risky when you're doing something like heat that is going multiple different layers, especially going down to the fatty layer. It could potentially dissolve your fat. It could break down some of the fat. It could melt it. I have a patient. She's an actress, and she, somebody did like too strong of a profound on her, and they ended up melting like a whole chunk of her fat in her lateral cheek there, and it's really unfortunate because she had like perfect cheekbones and everything like that, and it's like. The thing is that some of the stuff, it's like, I know you get kind of convinced because people put that out there. They put it up on TikTok, they put it on IG, they do everywhere. Like it's just out there. It seems like it's just supposed to be benign treatments that like are just easy and just fun. But like these are real medical treatments. Like there's still like real consequences to these treatments, and it really should be done with a lot of respect. You really should be looking at this a lot, especially as practitioners. They certainly should be, but even patients should look at it like this is a medical procedure. This is like I need to make sure this person is really somebody that I could trust and do this really, and is going to do a really safe job with this. Otherwise, like really, like either if you can't come to me or something like that, find someone in your area that could, or just don't do it. It's just like you feel like this is not like it's going to be safe enough for you. It's your face. It's like be really careful. We also need to fix this patient's face, but like I want it so that like you don't run into those kind of problems. I see so much of it. I see so many problems like this, so many issues like that, and like it's sad. It really is sad. Like because I deal with so much hyperpigmentation. I see so many laser burns. I see so many like burns from like radiofrequency microneedling. I see so much of that stuff. I see so many times where there's like this catastrophe that could happen. And I know that like technically, the numbers would say that it's not that frequent, but because I like, patients kind of come to me for these things, I see a lot of it. And so it's like, I get concerned. It's like, it's really, really worrisome sometimes the level of that people are doing things at, and it's inappropriate for the patient's skin. Somebody who's a darker Fitzpatrick and they're doing Morpheus 8 superficially with high heat, and they're leaving these track marks sometimes in the skin. And it's really unfortunate that kind of stuff still happens right now. I don't know. It's a sad situation in my mind, because it's like, I think that we really not just have to like kind of look at the practitioners, but also kind of look at some of the responsibility potentially of these companies that are selling it to certain practices too, because the way they sell it is sometimes unethical and sometimes really unsubstantiated, and the statements that they make are exaggerated. Sometimes they'll say, for example, that this radiofrequency microneedling device is as equivalent to a CO2 laser. And I got upset with somebody the other day because they were showing my acne scar result and claiming that was from like a particular laser and radiofrequency microneedling. And it absolutely wasn't. It's like, don't show my results for I don't want any laser company showing my results like that, because it's not because of the laser like that, and it's not fair to say it's from the laser like that. And then showing someone, and they're I've had people that have reached out to me and saying that they thought that I used that device for these scars, and it's like, no, it's like. In this particular case, I didn't even use it. And it's like, usually it's like, I don't recommend doing like radiofrequency microneedling for scars. I don't recommend that stuff. So it's really ridiculous to me that they're like pushing this stuff and saying that these are results from these devices. Just because I have it, I have like 26, 27 different devices, stuff like that. And so it's like, just because I have it, it's not because I'm not using it on this particular patient for that particular problem. I'm doing the right device for each individual patient for the right problem that they have. So it's like probably, double check, because it's like sometimes they say that this is like a result due to, this device. Actually, I caught a guy one time, one of the reps, he one time was claiming that this was like due to this device. And it turned out that the patient got like a facelift and a necklace. And it's like, they're showing you as if it was like an energy device that did this. And it was like a facelift, neck lift result, and like all sorts of stuff. And it's like, of course it's better because of that. Like this is ridiculous that you guys are showcasing this. And maybe like to top it off, they did something that, like that. They topped it off with a little bit of radiofrequency microneedling, but not anything else. Danielle is saying, I landed in Cali. Can't wait for my appointment tomorrow. Awesome, Danielle. Look forward to seeing you. Really, really do. I've been waiting to help you out with your skin. Really, really do. I'll be really happy to help you with that. Coco saying, oh my God, spilling the tea. Yeah, there's a lot of tea to be spilled, honestly, at some point. I think we really should look at it at some point, like all these things that are like pushed and I'll keep on like and kind of chipping away. I think, from what I'm hearing from a lot of patients, they are kind of now recognizing a lot of the flaws that these device companies are pushing. A lot of the things that the like sort of med spas were pushing about, acne scars and results and stuff like that. And I like that fact that people are no longer purchasing crazy packages with that stuff. My patient today, she's got excellent results right now. And she had done 12 microneedling sessions and like 3 Fraxel laser sessions. And she had huge rolling scars, backscar scars, ice pick scars, and 12 microneedling sessions she said did nothing for her scars. She said that she got a little bit of swelling for like 2 weeks. She would be happy, and then it'll end up showing casing again. And now I did 1 treatment with her 3 months ago, and she looks amazing, incredible already. So it's like it's sad. And when you actually think about it, it is so expensive. Like think about 12 microneedling sessions. How many thousands of dollars did that person steal from her? And then she also did 3 Fraxel lasers. It's terrible. It's terrible that she got no results from this stuff. And it's like, she ended up doing 1 result with me, 1 time with me, and she's already on the road to so much better improvement compared to where she was with microneedling. So again, these are things that like I want everybody just to pay attention to and just be aware of, that you're not going to get those kind of results. Honestly, I wonder, at some point somebody should audit like all these people that are pushing this stuff, and like really what's the incentive for really pushing these things and claiming these things, and kind of look at it and see what is this package that you guys are trying to sell to our poor patients that are suffering from whatever skin condition they have or whatever like insecurity they have. Like you guys just saw something that a vulnerable person in your office, and you started to just like nickel and dime them and like just try and literally stole from them thousands and thousands of dollars right there. Amber is saying for brown medium skin melasma, which is good, IPL or Moxie? That's exactly the point right there, Amber. Did somebody tell you IPL or Moxie for brown medium skin melasma? Did somebody tell you that's a good option there? I really want to know if that was like told to you that way. Marcy's saying, what do you recommend instead of microneedling? Well, look at our page. I talked about it before, but you could see one of my from almost start to finish there. On YouTube, I have a whole whole thing that I did. I spent the time to actually put it out there, to really work on it for you guys. I did a whole discussion while I was doing it, and then afterwards, and you can see really start to finish what really would work for certain kinds of scars. You can see it. It's a really great case, really complex scars for him, and see what's involved to treat and solve complex scars, and it's not going to be microneedling. And anybody who tells you, and that poor patient that you could see on that YouTube video, he's somebody who was sold laser before and microneedling before, and it did nothing for his skin. So it's like, just look at that and you'll see that whole journey for him. Fiji Princess saying, what do you think of red light mask? I don't think it's a bad idea. I don't think it's wrong. I just don't think it should potentially be too expensive. It does stimulate collagen production, so it's not bad there. Let's see here. So Amber saying, yeah, I had IPL, but my sister said IPL is not good. Your sister's right. I'm not sure why anybody would be doing IPL on a brown patient with melasma. Honestly, that's really, really unfortunate, and it's shockingly bad medicine. It's just shockingly bad medicine. It's like infuriatingly bad, and there's really no justification, no explanation for that one. And it's not like, and anybody upset with me saying that, it's just like, you're wrong. Like, it's just like any practitioner is like, oh, like I do it all the time, it's fine. No, you're wrong. Like, you're just wrong. Like, it's just not appropriate medicine to be doing IPL in a brown patient with melasma. And maybe you got away with it for a little bit of time, but you're going to run into a lot of problems if you're doing it that way. And really, there's just no question about that's just inappropriate medical care. And it's absolutely not something that I would recommend doing. IPL is one of the riskiest energy devices that's on the market. It really is. It's actually sometimes excessive amount of heat. It's okay for Northern European patients. You could do it, but I still wouldn't do it for melasma patients. I know you could technically do it a little bit for it, but there's still too much heat though, really. Even if they say there's a lot of contact cooling, things like that, there's still too much heat. So there's better devices out there, or maybe even no energy device. And so it really is poor medicine for someone to do that. It really is similar to the way I was talking about that yesterday, about how inappropriate people are with their antibiotics and the way that they prescribe antibiotics. It's so unfortunate, and that in this case is what you just went through. Like this is like a classic example. It's like somebody who's sitting there and doesn't know medicine really for some of the stuff. It's like it's just like shockingly bad medicine to insist. And even, you know, I like Moxie for certain things, but like I wouldn't recommend it for a brown patient with melasma. I know that they say it's okay for that, and I like Cytotime for certain things, but like that's really, there's a lot of heat with that. And you know, anybody that does Moxie knows there's a lot of heat with it. So I don't love heat when I'm treating melasma patients. And there's a lot of reason for that. So, you know, a lot of the stuff, it's like, I don't know what they're talking about. I really don't. It's like, I look at the stuff and I listen to some of these people and I watch these things on these videos and stuff. And it's like, I don't know what people are talking about and what they're pushing on sometimes. Mona saying, Dr. Qazi, I love my chin filler. You popped off. Thank you once again. Awesome, Mona. Appreciate you, Mona. Thanks for coming on for saying that. Honestly, I love doing filler. It's really fun. About Kimmy saying, have an appointment with you tomorrow. So excited. Thank you so much, Kimmy. I'll try to remind me that you were on here again for what your screen name was, so I'll be able to tell you what up. Let's see. Do you recommend tretinoin? I love tretinoin. I've been doing it really since I was like 15 or 16 years old. It's like the best product like in the world, honestly. That's why I talked about this before, but I don't believe in like medical grade skincare stuff. I don't believe all that kind of nonsense. I don't think anybody proves that there's something like this medical care skincare. It's like medical care skincare. It doesn't to me make any sense. But like tretinoin makes a lot of sense. It's a prescription-based product that makes sense. You know, sometimes you could use like sparingly a little bit of hydroquinone, which is prescription-based. That's very different than when it's claimed that like, oh, my products are like made in a lab and it's like superior to other people because of like the concentration of like BS. Okay, it's like no, like you know, Vanity Cream's awesome moisturizer. Like no, and it's not like nobody's going to consider that, oh, it's medical grade and like it needs to be like super expensive for that. It's like $20 for a huge container, and it's awesome. And like that's all you need. Like Vanity Cream is excellent, and so I don't know what they're talking about sometimes with this medical grade stuff. And there's a lot of like, there's so many different things out there now that we could kind of see that like you really don't need to be spending that much money on these things. That's all. I definitely tretinoin's awesome. It's a great product. Continue using it forever. How do I feel about Botox? Botox is awesome. Honestly, I think it's underused. Honestly, I know people love it, and I do so much of it, but I still think more people should be doing it. You have expressive, you have lines there. You know, what happens is that you do stretch out your skin that way. Sometimes it could cause a little bit of a headache too as well. So it's important really to do a little bit of that just to relax the muscle. Tears of Geisha saying Botox or Dysport. Dysport, honestly, Dysport really. That's my unsponsored like thing. I've gone through every single product, and I find Dysport to be the best. I think that there's some patients that like, you know, they do like Xeomin, and that's totally fine too. But between almost all of them, I do think that Dysport's an excellent product. It's a really nice product that tends to last us a little bit longer too. It looks like really natural. I don't find it to be too heavy for patients. It's just like, I love it. Ruby saying, do you feel filler for NLFs is a good idea, or would it migrate or cause pillow fades? It depends on where they're placing it. It depends on what product they're using. I wouldn't use Juvederm in the nasolabial fold. I don't recommend it ever for patients there. I dissolve so much Juvederm in the mid-cheek area after they've done it in the nasolabial fold, and so I wouldn't recommend it at all. But you could consider doing something that's a little bit of a lighter product, depending on where they place it. I personally prefer the Bellafill. It works incredibly well in the nasolabial fold. I love it. All my patients love it. Everybody loves it. It's just like, it's a soft filler. You know, I've done it on my family members too, things like that. And like people that really want to make sure, you know, I would hear it forever if like I messed them up. You know, it would be kind of like a thing that like all the time I'll hear that like, you know, you messed up one of your like relatives or something like that. And it's like, Bellafill is like excellent, and nobody has to know about it. It just looks soft, it looks natural. It's like really, really nice. What about RHA? That's what I was talking about earlier. I don't love it. I'm sorry. You know, sorry RHA reps. You know, I tried it out. I thought that it was just like something that you put it in and you sort of like kind of estimate how it's going to look afterwards. And then later on, it's just drawing in so much water. It just keeps on drawing in water and keeps on growing and growing and growing. And so, you know, I didn't love it, but maybe I'll try it one day. I don't know. But like to me, a lot of times it's like one shot, one opportunity. Sometimes for these things, it's like I tried it out, didn't love it, and it's like, okay, you know, it's not really the product for me now. And you know, I have a lot of other products that I just love and I use, and so like why switch it at this point? I know it's less expensive for some things, but like you know, it's not great. So can you repeat the product you recommend for an NLFs? I use Bellafill in the NLFs. But there's very few of us in the country who do Bellafill, very few people. And so just be careful with where you're going. If the person is not comfortable doing Bellafill or doesn't do enough of it, then like just see what other product they're considered. I just would not do Juvederm in there. Beat is saying your opinion about microneedling for scars. That's what I was talking about earlier, that it's really not effective. The patient that I worked on today, she had done it like 12 times, and after I worked on her like 3 months ago, now I saw her again, and it's like significantly better. She said that nothing else came close to what she had right now. All the other things was just basically a waste of thousands of dollars. So that's my my spiel tonight. Just pay attention to a lot of the stuff. It's like I want you also to like kind of be educated, even if you're like further away from me. Just feel like now a little bit. Like if somebody's like commenting certain thing, if some injector is there and they look super puffy and super overblown, and they're going to tell you that they're going to do like a natural look for you, just kind of look at it and wonder like, is that really going to be achievable with this particular injector? Just kind of look at that and see like, is it possible? Is that really what they're going to do? Or is the aesthetic that they think is natural different than what you think is natural? And kind of go more for that, kind of see like what the look that they're trying to achieve, that they themselves have achieved. And if they're looking at this themselves and they think that this is natural and they're looking at it and it looks like kind of alienized, chances are that's what they're going to do to you. Like that's the thing. Like that's the reality, because that to them is their aesthetic, and it's like good luck to that, but like probably isn't the vast majority of people. So the vast majority of people don't really have that aesthetic. Bao Kimmy is saying, what do you recommend best for a lip filler? Usually Restylane Kiss, usually. B. Buncor is saying, what's your opinion on CO2 ablative laser for scars and how deep can he go? Actually, I'm going to answer. I was planning on going off tonight, but on checking out, but I will answer. It's a really good question. Anyone who does lasers with me knows I actually don't go too deep. I don't. I do actually very localized areas for where it's raised and thick. Those are the areas that I use the CO2 laser. And I could blend it in with other lasers, but I'm not doing multiple passes. I'm not going really aggressive with it. I'm not bulking the skin. I'm not a big fan of it. I get beautiful results and without doing any of that stuff. So, I think you have to kind of look at it and say, like, why does a person have to do such strong energy on my skin? Most of my patients are darker skin type. 85% of our patients are Fitzpatrick 4 and above. And so it's like I'm very, very careful with darker skin type, and we have to be really careful with lasers and energy devices. So it's like when I'm doing it, I'm very, very precise if I'm doing it. I'm not gonna like just go and burn down like the whole area there. So I know some people say that that's what you have to do. It's just not true. It's just not true. I do probably the amount of scars and work that I do with this, I do so much of it, and like they would have to really showcase that they do so much of it too, and we would have to showcase like just basically head to head what our data would show to each other, and like the adverse events and like the patient satisfaction and the results, everything like that. And I don't think that anything would really compare. So like anybody tells you that they have to go like fully ablative and like go all over your face fully ablative, I think that you really should just look at that as a red flag, to be honest with you. It's not true. Especially in darker skin types, it's just not true that you would have to do that. I think that the chances are that they're not used to doing something like manual work like subcision. They're not used to doing something like TCA cross. They're probably not used to or just not understanding the amount of volume loss that occur with scars, and they don't know that you're supposed to put things for volume, and they're just trying to use lasers and high energy these devices that could lead to more scarring. It could lead to really prolonged redness and hyperpigmentation, all those things. And just follow my aftercare. You're going to get through everything without any of those problems, and we'll still get you excellent results. So it's like you don't have to do this thing where it's just like fully ablative and going super deep, despite what everybody tells you. Just like all that stuff, we have to kind of look at it. I know there's actually a bunch of stuff out there in the world, and people say and make these claims, and there's so much stuff, and they act like they're the authority. But you also just have to see kind of like, where's the evidence, where's the proof. You sort of have to do something like that, because it's like, what can you showcase for me? Like, where is this proof right now that what you're saying? Like, I want to trust you, but at the same time, it's like, I've been in this world, and I've been, tricked by doctors, so it's like, it's true. I've been tricked by doctors. I was tricked when I had scars. I was tricked by doctors, and I've been tricked actually when I opened my business. I was tricked by doctors. So it's like sometimes like my own my own medical professionals suck with some things. Like really, it's like, what can I say? Sorry, sorry that some of my doctors, like my colleagues, suck. It's unfortunate, and I know that they, the reality is that people say that, there's expertise and all this stuff. But like, what is the real expertise that you're saying? And like, who are you shoving this to? And like, who are you presenting it to? Who's sponsoring your studies? Who's doing all that stuff? Who's doing it? Like, where is it coming from? And when you dig into it, it turns out a lot of it's like company sponsored. A lot of them are talking to the, for these device companies, or talking for these filler products and stuff like that. And it's like, why don't you expose that? Why don't you tell people that? You don't do that. Smiley saying, that is sad. How did somebody trick you when you started your business? Actually, several doctors did. It's like, it wasn't just like one time. It was like, I was very naive. Like, I came into this with my background. I was like looking at the world like kind of naively, thinking like people in my profession were like caring about like other physicians and stuff like that, and cared about patients and stuff. And I was like, it turned out that like so many people were like telling me to do a device. And, there was like a rep that would come by, and I would say, oh, okay, that's really cool. And they'll say, why don't you talk to a physician? He uses the device. And I didn't know that the physician was getting like a kickback from the device company. It wasn't revealed to me that the physician was a salesperson, and they were getting, money to convince me to use the device. It's wild, actually, and there was so much of that kind of stuff that was happening. And it was like, sometimes it was like a crappy device that I got from them, because it's like, I trusted the physician. I thought, this is a nice guy. He's a really nice guy. He makes like videos online, and he's like a really nice guy and all this stuff. And of course, it's never live or anything like that. But like, it would be like, it looked like it was like a nice polished kind of guy, like really decent, type of thing, and a good following. And so it's like, wow, this guy, it's a really, really great guy. And let me go talk to him and see what he does. And he loves this device. And it turns out he's getting thousands of dollars for me purchasing the device, and it wasn't revealed to me. And that's not just like one time that it happened. It was like multiple times. So, and it was like a piece of garbage device too. Sometimes it's like a piece of, and it's like, and like, it's obviously is. And it's like, there's no reason whatsoever for you to like to try to push this device on another physician, unless you just want to be you're a salesperson right now. And instead of a physician, you're a salesperson. That's what these guys are doing. And it's like, it's wild to me. It's absolutely wild that this is the world right there. And I'm not sure why we accept this. I really don't. I don't understand why this stuff is like, just like, it's gotten so corrupted. The way that people have been incentivized for money is like so corrupt, and it's like so unfortunate, because it's like, we could have had a better society, but these guys just want to like, trick everybody, and they just think that like, if they don't trick somebody, someone else is going to trick you anyway. So it's like, they may as well make the money. That's how people view it. It's just like, and nothing ever changes because of that. It's like, just like this right now, this cycle that we go through, like this rat race right now, it's like just constantly the same thing over and over and over again. And it's like, because nobody wants to change anything. Even in dentistry, I'm sure it's the case. I'm not familiar with it per se, but like, to me, I always do feel like the dentist, I mean, I hate to say, I know you may be a dentist there, but sometimes it really does feel like I'm being pushed by dentists. Like, do I really need like the deep cleaning that like my insurance doesn't cover right now? I don't know. It's like, I'm not sure. Is it really true? Thought I had perfect teeth, and like another dentist didn't see anything wrong with it. Like, do I really need that stuff? I'm not sure. Like, I don't know. Like, I'm not a dentist or anything like that, but like, sometimes it's like kind of questionable. I'm like sitting there like on the chair, and like, they'll like send in like the sales rep and say that to me. And they're like, oh yeah, you need to like do deep cleaning, and like deep cleaning isn't like covered by your insurance. And it's like, did I really need deep cleaning? I don't know. My teeth seem like they're really clean. Did it really need it? I don't know. And you just sort of have to trust it. But like, it's kind of like really, I don't know. It's like, it's unethical if they are lying, but like, there's an incentive for them to lie sometimes. So it's like unfortunate. And I don't know, it's like one dentist will tell you one thing, another dentist will tell you another thing. And then it's like, it should be pretty objective, really, when you think about it. You're looking at gums, you're like, does it need deep cleaning or not deep cleaning? And it's like, it should, to me, be like pretty objectively like clear. And, they just happen to also make a lot more money if they do deep cleaning. So it's like, is that what I really needed? Or is that just because the guy like tried to throw something else more there? Smiley saying, I got so many cavities drilled and filled, and I don't know if they really were. It's crazy, actually. I've actually heard people say that that other people like have worked with dentists too, and they say that really, yeah, that's the case. That they do they do that kind of thing with people that don't have cavities. I'm not saying all dentists or anything. I'm just saying sometimes that's how I feel. Like I'm sitting on a chair and I'm like, I don't know. It's like, I guess I'm sure if you say I need it, but I'm not sure. Like, it seemed like my teeth were pretty good today. My gums are pretty good. Did I really need to do it? Or just throwing it at me? Like, just do things that are like proper. Smiley saying I went from 0 cavities to 14 all of a sudden. Yeah, that's crazy. That's a crazy situation. 0 to 14. So I don't know. I think, by the way, you could like everybody was booking for their dentist appointments right now. A lot of people were saying that they had to do a dentist in the office too and things. Latest keloid treatments you're liking. Are you still stuck on Kenalog? I use 5FU and Kenalog. I don't really have any more than I do right now for that, but I do that and then XLV for some of the vessels that are there. I don't do too much more than that there. Bree saying, happy Halloween, Doc. What's your costume? This is Prince Charming. This is a Prince Charming costume right here. So that's my costume. I think I'm going to change it up next year, though. This one was kind of a little bit flimsy. I'm going to try to do something else, though, a little bit there. But I liked it, though. It was kind of fun. All right, guys. Thank you so much. Appreciate you. I will see you again on Monday. I will see you Monday. And someone's asking about thoughts on HIFU. Not great. I would not recommend that. So that's like the ultrasound with heat. Would not really recommend that, though. Altera, for example. People don't really love that. But anyways, guys, I appreciate you. I will see you on Monday. If there's any more questions, just keep on messaging me. I'll keep on hitting. A lot of these questions, by the way, I answer like when you guys